Prescription drug coverage is not included with original Medicare, and since prescription drugs are the highest cost category for many Americans, Part D prescription drug coverage becomes a big deal. Now, the two most common routes that people take to get prescription drug coverage would be to get a standalone Part D prescription drug plan purchased separately from their supplement plan, or get a Medicare Advantage plan that has prescription drug coverage included in the plan. In this video, I will show you how these two paths are the same, and then what you'll probably want to know even more is how are they different. Now, I already know that people will jump in the comments bashing one or the other topics that have nothing to do with medications. This video is just about drug coverage, not the other stuff. We have around 100 videos on our channel right now, and probably 20 or 30 that go over all of that other stuff. So go watch those if you're looking for the pros and cons of each outside of drug coverage. But when it comes to drug coverage, let's first look at how these two routes are the same to clear up some myths, and then we'll look at how they are different, which again is probably what everybody is here for anyway. And we'll start with the general structure of Part D plans. We have a whole deep dive video on our channel about how Part D plans work in 2023, how they're changing in 2024, and how they're changing again in 2025. But currently there are 4 phases of coverage: the deductible phase, the initial coverage phase, the coverage gap, also known as the donut hole, and catastrophic coverage. Both standalone Part D plans, if you go the supplement plan route, and Part D plans with an Advantage plan have the same structure with the same 4 phases and the same dollar limits on each phase. For example, the maximum deductible for Part D plans in 2023 is $505, and it will be $545 in 2024. The same maximum limits apply to both plans. The next part of the structure would be formularies and tiers. The insurance companies that offer both standalone Part D plans as well as Part D plans that come with the Advantage plan set what is called a formulary. The formulary is the full list of medications that the insurance company agrees to cover. Again, there are federal guidelines here, but every insurance company is not required to cover every medication out there. So when you're picking a Part D plan, you may have a specific medication that is not covered on one plan, but it is on the other. That's because the medication is not on one formulary and it is on the other. Even if the drug is on formulary, though, the insurance companies set the drug tiers. And what this means is that all of the drugs on the formulary are organized and classified into usually 5 tiers. There are plans with more or less, but typically there are 5. The first tier is preferred generics. In general, these are low-cost medications. The second tier is just general generic medications. Again, it's usually still low-cost medications. The third tier is preferred brands. Brand medications start to get a little bit more expensive. The fourth tier is non-preferred drugs or non-preferred brands, getting more expensive still. And then the fifth tier is specialty medications, typically the highest cost medications. As you can see, as you go up into a higher tier, the costs typically go up as well. Not just the cost of the medications, but your coverage as you go up in the tiers typically changes to where you have a higher cost responsibility in the form of copays or coinsurance. As an example, a tier 1 medication may be covered 100% and you pay nothing, or it has a super low copay like $1 or $5. A tier 3 brand medication may have a $40 copay. A specialty medication may have a 30% coinsurance on a several $1,000s a month medication. So the point is, not only does the formulary matter, but the tiers matter. Some insurance companies may have the medication that you need classified as a tier 3 drug, while another company may have it classified as a tier 4 drug, and that can make a big cost difference to you. All right, the next general thing that these have in common is that unless you qualify for a special enrollment period, if you want to make a change, meaning you want a different plan, maybe because something happened in the middle of the year and you need to start taking a new medication that wasn't on formulary, or your doctor switched you to a different medication on a higher tier because the alternative just wasn't working for you as well, you are only allowed to make changes during the annual enrollment period. This is October 15th through December 7th every year. And when you change that plan, the new plan starts taking effect on January 1st of the upcoming year. So if you pick a plan and you start a medication, say in March, that isn't on formulary or it's tiered in an expensive way, you have to wait to change during AEP, and the new coverage doesn't start until the next January. Okay, that's how these plans work the same, regardless of if you do a supplement with a standalone drug plan or you do an Advantage plan with a Part D plan included. Let's move into how they are different. The differences start with the costs just to have the plan, because for some, monthly costs are the biggest factor in their decision. Standalone Part D plans have a monthly cost that you need to pay just to have the plan, whether you use it or not. The average in 2023 is about $31.50 per person per month. There are plans that are much lower, as in less than $10 per month, and there are plans that are much higher, as in $100 or more per month. Contrast that with the Part D plans that come included with Medicare Advantage plans, and this is a significant difference between the two options. A standalone drug plan will cost more from a monthly premium perspective than the no-cost Part D plan that is part of an Advantage plan. There's no other way to say it, but this isn't the only factor to consider. Let's keep going. The next difference between the two would be the deductibles that we mentioned earlier, specifically how that deductible is handled. I need to stress that where you live matters, and this could all be different for you because you live in a certain area. But in general, standalone Part D plans have higher deductibles than the Part D plans that come with an Advantage plan. Let's dive into that. We already discussed the cost of standalone plans. Well, those different plans, they have different formularies, that list of drugs that are covered, and different tiers. So that monthly cost generally has an impact on these things. What drugs are covered, how they're covered, and the deductible. So of the most popular drug plans in our area, which is the Intermountain West, the majority of the standalone plans have a deductible, and the majority of those have that maximum deductible of $505 in 2023. Having said that, there are two considerations to remember here. Number one, there are standalone plans that do not have that maximum deductible, as well as plans that do not have any deductible. These tend to be the higher monthly premium plans. Number two, many plans, not all, but many, are built where the deductible does not apply for lower cost medications on the lower tiers. The plans start covering before you hit any sort of deductible. For example, Tier 1 and Tier 2 drugs maybe don't need to meet the deductible to be covered, or some have Tiers 1, 2, and 3 drugs fall into this. So while they have a deductible, some plans only have that come into play for those on higher cost brand or specialty medications. Okay, let's compare that to the typical Advantage plan in our area. Many Advantage plans do not have a Part D deductible. Of the 10 most common plans in our area, 7 of them do not have a deductible. So the cost difference here so far is in favor of the Advantage plans, in that the Part D plan comes included in the Advantage plan at no extra cost. And in general, the Advantage Part D plan's deductible situation is more beneficial, with either no deductible or lower deductibles that apply on higher tiers only. Now, here's where things get a little bit more nuanced. When you go on an Advantage plan, so you go the Advantage plan route, the insurance company you pick is now taking over all of the responsibility of your healthcare. You are replacing original Medicare with the Advantage plan. You are not adding more to the original Medicare that you have. You are replacing it with the Advantage plan. So now this insurance company manages all aspects of your care. You are left to the policies, the procedures, and the customer service of the insurance company that you picked. Now, these insurance companies must comply with strict federal guidelines, but they do make their own policies. Now, going along with that, if you are picking a no-cost Advantage plan for the medical out-of-pocket maximum, or for the dental benefits, or whatever other perks are coming with this plan, you must make sure that the medications you take are on that plan's Part D formulary. Otherwise, you could run into some major problems. But it goes one step deeper. Going along with the Advantage plan route, if you have issues with the drug coverage, you would need to change your entire Advantage plan, and you can only do that during the annual enrollment period that we discussed earlier, the one that runs from October 15th through December 7th of each year. And if you do change those plans, those changes go into effect on January 1st of the upcoming year. On top of that, by changing plans for better drug coverage, you'll need to relook at the new plan and if it covers all of the other things in the same way. More specifically, does that new plan still have your doctors and hospitals in network? What does that medical out-of-pocket maximum look like? How are benefits like dental, vision, or other benefits impacted? So there can be a lot to consider just in that decision there if you're switching an Advantage plan for the Part D aspect. So Advantage plan Part D coverage can be great for some people, especially if your medications are on formulary and tiered in an advantageous way. It can also be not so great for some people if their medications aren't on formulary or they're on higher tiers, and then switching drug coverage can mean switching everything, including hospital, medical, dental, and other things. A standalone drug plan is by itself. So if you love your supplement plan, but your drug plan isn't working out, You don't have to switch everything around. You just need to pick a different standalone Part D plan, and you can keep your supplement plan. You can keep your dental plan, vision, or whatever else that you have the same. The supplement plan is much more of an a la carte route where one benefit doesn't necessarily affect the other benefits. There are typically a lot of different standalone Part D plans available in most parts of the country. So if you are someone that has a lot of different brand medications, finding a standalone plan that covers all or a higher percentage of those is a little bit more likely. Having said that, there are people with a complicated mix of medications who may find that regardless of the path that they take, whether a standalone Part D plan or the Part D plan that's part of an Advantage plan, they may have one or even multiple medications that are not covered by Part D plans. It does happen. So what's the biggest takeaway that I hope you can take from this video? The biggest thing that I hope you take away is that your decisions around Medicare and other plans, including prescription drug coverage, are not one-size-fits-all decisions. Your health, your medications, your financial situation, your doctors, your preferences are not the same as someone who comments on this video who lives 1,000 miles away from you. You are not the same as your coworker or your sibling or even your spouse. So do not make your ultimate Medicare coverage decisions based on a YouTube video, including this one or any of our other videos. Don't make your ultimate decision based on an article that you read or a plan that your neighbor got. I mean this with all sincerity. You are unique, and especially when it comes to your prescription medications, make sure that you are working with an agent who can run your medications and compare the different plans available to you, both standalone plans and Advantage plans with Part D coverage. If you do want to do it all yourself, please be careful, and I would recommend Medicare.gov as a resource for you. Just make sure that you look at the details around covered medications and then look at your lowest estimated cost, not just the premium numbers. If you've made it this far, I hope that this helps you with your prescription drug medications and your decisions as you approach Medicare. If you're feeling super generous, giving this a video like would be amazing. If you haven't already, subscribe to our channel if you enjoy learning about the ins and outs of Medicare. I appreciate you, and I will see you in the next video.